Hello, my name is Dr. Christopher Strelka, and I'm the Medical Director for Julia Hospice Palliative Care. And I'd like to welcome you today to the next in our series of educational webinars. Today's webinar is entitled Julia Palliative Care, and I'm very excited to give you some information today about Julia Palliative Care, which is a new specialty service that we have just opened, and we are accepting new patients. So let's begin our webinar today, again, entitled Julia Palliative Care. So in today's webinar, I want to answer five specific questions. First of all, what is palliative care? What is the difference between palliative care and palliative medicine? Who needs palliative care or palliative medicine? What is Julia Palliative Care? And what specific services will Julia Palliative Care offer the community? What is palliative care? Palliative care is a philosophy or an ideology or a model of care that focuses effort and energy on improving the quality of someone's life, not necessarily the quantity of someone's life. So we're really not focusing on trying to extend life at any cause. We're really focusing on the contributors of pain and suffering, and we're trying to work together with all of the other traditional caregivers and physicians to create a more effective team-based plan of care that gets to understand the person behind the illness and what is important to them, and using whatever complementary or alternative treatments that are available to improve the quality of someone's life, and more specifically to enable greater well-being. Again, palliative care is used together with traditional treatments. So it's really supportive, it's complementary, it's adjunctive treatment, working together with all of the other specialties, physicians and caregivers to bring about a greater sense of well-being. We want to address all elements of pain and suffering. We understand that it's not always physical. Often there's a component of emotions or psychological distress, maybe spiritual or religious distress that is contributing. And as I've alluded to, palliative care is really a extra layer of support for you and your family. What is the difference between palliative care and palliative medicine? Palliative care, again, is really a philosophy or an ideology of how to care for someone, focusing again on the quality of their lives. It really requires experience. So the physicians that really have an understanding of what palliative care is and the kinds of treatments to coordinate together to improve the quality of someone's life, it really requires being experienced as a caregiver or as a physician. Palliative medicine is an evidence-based, accredited medical specialty. So it is recognized or accredited by the American Board of Medical Specialties, and palliative medicine requires additional training. So you currently have to complete at least a one-year fellowship at an accredited training program, and to become board certified after completing the training program, you have to pass a fairly rigorous 8-hour examination to be a board certified palliative medicine specialist. Palliative care, palliative medicine really is focusing on what we now refer to as the serious illness population. So these are primarily adults over the age of 65 that are living with and managing at least one potentially life-threatening or serious medical illness. We know that the overwhelming majority of people, regardless of what the cause or whatever serious illness they're dealing with, whether it's heart failure, whether it's cancer, whether it's lung disease, the overwhelming majority of people complain of some type of physical or emotional pain. And oftentimes these illnesses cause other distressing symptoms like shortness of breath or anxiety or confusion or restlessness. And these symptoms can be very burdensome and very distressing and reducing the quality of someone's life. So just focusing on all of these different contributors of total pain and suffering oftentimes leads to improvement in the overall quality of someone's life and helping them achieve a greater sense of well-being or health and happiness. We also want to focus on individuals who have impaired function or debilitation, meaning that they need help or assistance with maybe an activity of basic daily living, like getting dressed or bathing or going to the bathroom or standing and walking. In general, we're talking about individuals in our community who likely have less than 2 years to live, meaning that their illnesses are slowly progressing, and again, they will eventually be at the end stage of their illness or in the final phase of their lives, and they need help transitioning from the treatment of their illness to that end of life phase. What is Julia Palliative Care? Julia Palliative Care is the first community-based office practice in palliative medicine ever in Erie County. Right now in Erie County, if the only access to palliative care services that the residents of Erie County have is if you happen to be an inpatient at either of the two major hospitals in Erie. Once you're discharged from the hospital, unfortunately, there really are no comprehensive palliative medicine or palliative care services available. So Julia Palliative Care will be the first provider of palliative medicine and palliative care services outside of the hospital in Erie County, especially for those who are Medicare beneficiaries of Medicaid, or have Medicare Advantage plans that have supplemental benefits that cover palliative care services outside of the hospital. Julia Palliative Care is owned and operated by Julia Hospice Palliative Care, and it'll be staffed by one of only 2 fellowship-trained, board-certified palliative medicine physician specialists currently in Erie County, and that person is myself. So I have been a physician for over 30 years, and I've spent my entire professional career here in Erie, and I did several years ago complete a 1-year fellowship in hospice and palliative medicine at the Cleveland Clinic, and I am currently board certified in hospice and palliative medicine. My goal through Julia Palliative Care would be to work together with your other physicians and caregivers to help coordinate or more effectively coordinate your care and to more effectively manage your serious illness, with the goal of improving the quality of your life and overall enabling a greater sense of your well-being, both health and happiness. I see Julia Palliative Care as being an important educator, helping you and your family better understand your serious illness and what it means for you and your family as the disease progresses or as time goes on. Specifically, Julia Palliative Care will help better manage any source of pain and suffering that you're experiencing, or any other symptom that you may be experiencing related to your illness. We also, again, believe that for you to make the best decisions regarding your care, you need to have the best information regarding your illness. So health literacy, or improving your understanding and your family's understanding of your illness, is paramount, so that we can work together with you regarding goals of care planning. So we know that people's expectations and wishes and preferences change throughout their lives, and your illness is going to change and likely progress as time goes on as well, and that will mean different things to you regarding care that you want currently to care that you may want or not want in the future. Advanced care planning is a specialized type of education and planning. In the United States, it's everyone's right to participate in their own care if they want to. If you have any strong feelings regarding care that you want or that you don't want in the future, this is going to be the chance to understand you as a person and what's important to you, and to try and put your wishes in writing or an action plan in the form of a medical directive or medical orders. Chronic care management is a specific type of management that we want to provide, especially for those in our community who have 2 or more serious illnesses. The care of a serious illness, one serious illness, is complicated, but to have 1 or 2 or more, rather, is even more complex and complicated. So oftentimes having another individual helping to coordinate and manage care is important, and that's what will be involved in chronic care management. It is a per month, per beneficiary service that we will be offering. Care plan oversight will be, again, a specific type of care that we will be offering those receiving home care or hospice care in their own homes. Again, another set of eyes and ears to listen and to review the treatment plans to try to modify them in any way to improve quality of life and enable greater sense of well-being. Julia Palliative Care is located at the Way to Healthy Living Center, Suite 3 on Zook Road. We're now open and we're accepting new patients, and we're really focusing on the Medicare, Medicaid, and Medicare Advantage beneficiaries. Again, right now, those people only have access to palliative care services if they're in the hospital, and there's really no services for them outside the hospital. So we'll be the first provider of this supportive care available to them. The Medicare patient beneficiaries do not need a prior authorization from Medicare or a referral from their primary care physicians. They can self-refer anytime they want, simply by calling 814-440-3275 for an appointment. So we're open, we're accepting new patients, and we really look forward to seeing you. We know that people are struggling out there, and we want to be able to provide some additional support for you and your family. Thank you so much for attending this webinar.